Anatomy and Growth. Published by WordPress.com. Anatomy of long bones. Epiphysis. Bony ends of long bones forming joint articulation. Composed of loose cancellous bones surrounded by a thin cortical bone layer. At birth, consists of chondroepiphysis, which undergoes secondary ossification at characteristic times for each bone. Exceptions. Articular cartilage remains at maturity, and the physis closes at maturity. Physis, growth plate. Responsible for longitudinal growth through endochondral ossification. Divided into distinct zones. Reserve zone. Small rounded cells in groups. Stem cells. High matrix content. Collagen type 2, aggregated proteoglycans. Moderate oxygen supply. Resists tension forces. Defect. Gaucher's disease. Proliferative zone. Thickest layer with columnar chondrocytes. Active mitosis and glycogen storage. Rich in blood supply, high oxygen tension. Resists compression forces. Defects. Achondroplasia, gigantism. Hypertrophic zone. Weakest zone, prone to physeal injuries. Maturation and hypertrophy of chondrocytes. Little matrix, calcium storage through mitochondria. Template for bone deposition. Defects. SCFE, rickets, acromegaly. Phases of hypertrophic zone. Maturation zone. Degeneration zone. Provisional calcification zone. Facilitated by ALP, collagen type 10, and matrix vesicles. Metaphysis. Transition zone between the diaphysis and epiphysis. Contains loose cancellous bone surrounded by cortical bone. High radionuclide uptake in TC bone scans due to active bone turnover. Primary and secondary spongiosa. Primary spongiosa forms by endochondral ossification. Secondary spongiosa undergoes continuous bone remodeling. Defects. Scurvy, SCFE, corner fractures. Diaphysis, shaft. Tubular cortical bone encasing the medullary canal. At birth, composed of woven bone without haversian systems, later remodeled to lamellar bone. Grows in width via appositional bone growth and endosteal remodeling. Transverse lines, Park and Harris lines. Dense trabecular linear patterns within the metaphysis, indicating growth arrests after trauma or illness. Periosteum. Thicker, more biologically active in children. Loosely attached to the shaft but tightly adherent at the physeal ends. Composed of outer fibrous layer, includes the perichondral ring of LaCroix. Inner cambium layer, osteoblastic, chondroblastic, and fibroblastic, aiding in metaphyseal and physeal growth. Bone marrow. Functions. Source of progenitor cells. Controls the inner bone diameter. Types. Red marrow, hematopoietic, decreases with age. Yellow marrow, inactive, composed of fat. Bone formation types. 1. Endochondral ossification. Bone forms on a cartilage model. Occurs in embryonic long bones, physeal growth, and fracture healing. Defects. Achondroplasia, cleidocranial dysplasia. 2. Intramembranous ossification. Bone forms directly from mesenchyme without a cartilage model. Occurs in embryonic flat bones and rigid fracture healing. Bone growth in long bones. 1. Longitudinal growth. By the physis, ends at maturity. 2. Appositional growth. Increases bone girth through periosteal deposition. Small cuboidal bones grow by interstitial cartilage proliferation and appositional growth. Factors affecting growth plates. I. Hormonal factors. 1. Thyroid hormones. Act on the proliferative and upper hypertrophic zones. Promote chondrocyte growth. Alkaline phosphatase, ALP, activity. Collagen type 10 production. 2. Parathyroid hormone, PTH. Acts on the proliferative and upper hypertrophic zones. Increases mitosis, proteoglycan synthesis. 3. Calcitonin. Acts on the lower hypertrophic zone. Accelerates growth plate calcification. 4. Growth hormone, GH. Acts on the proliferative zone. Binds to chondrocytes, increasing number of receptors. Synthesis of insulin-like growth factor 1, IGF-1. 5. Glucocorticoids. affect cellular differentiation and proliferation zones. And 6. Sex hormones, e.g., androgens, act on the lower hypertrophic zone, promote mineralization, proteoglycan synthesis, glycogen and lipid storage. Vitamin factors. 1. Vitamin D. Acts in the proliferative zone, not in the hypertrophic zone. Enhances mitosis, DNA synthesis, proteoglycan synthesis. 2. Vitamin A. Excess leads to impaired maturation, resulting in abnormal bone shape and fragility. Causes lysosomal body membrane fragility. And 3. Vitamin C. Promotes collagen synthesis. 3. Environmental factors. 1. Infections. Affect the metaphyseal portion due to slow circulation, low oxygen tension, deficient reticuloendothelial system, RES. 2. Irradiation. May lead to shortened longitudinal growth, sparing of latitudinal growth. IV. Pathologic conditions. 1. Genetic disorders. Collagen defects, e.g., spondyloepiphyseal dysplasia, proteoglycan metabolism defects, diastrophic dysplasia, mucopolysaccharidosis. 2. Metabolic disorders. Defective mineralization, hypophosphatasia, X-linked hypophosphatemic rickets. And 3. Nutritional disorders. Nutritional rickets, vitamin D deficiency, scurvy, vitamin C deficiency,